Hello everyone, my name is Zach Hansen. I'm a physician assistant working alongside Dr. Kurtis Staples for Sonoran Orthopedic Trauma Surgeons in Phoenix, Arizona. Today we are demonstrating surgical fixation for a humerus fracture. Patients most commonly end up in ROR with this injury following ground level falls, cycling accidents, and high energy vehicle crashes. Here we see numerous examples of humerus fractures on X-ray. The goal for surgery is to restore anatomic alignment and to allow for proper healing and expedited return to function. We begin by making an incision on the lateral aspect of the arm. We use an electrocautery knife to help perform the dissection down to the fracture site. During this dissection, the main anatomic structure of concern that we need to identify and protect is the axillary nerve. This nerve lives within the deltoid muscle body. It helps give innervation to your deltoid and rotator cuff. Once the nerve is identified, we can continue with the dissection to the bone. At the fracture site, we fully expose the bone to assess next steps of fracture reduction. There are often soft tissue tethers and attachments to the fractured segments that must be released to allow for the bone to move more freely and return to its correct position. We use a curette and sterile saline flushes to clear out clot and debris and to clean up the bone edges, which gives us a better view as to how these puzzle pieces best fit back together. Having clean bone edges free from tissue gives us the best opportunity to get a cortical read on the fractured segments to key into place. Using a clamp, we've reduced the bone fragments back into anatomic alignment. To secure this alignment, we place a lag screw across the fracture. We begin by creating a pilot hole halfway into the bone with a drill bit that matches the diameter of the screw's thread's width. We then finish the drilling through the bone using a smaller diameter drill bit. This technique allows for the lag screw to glide through the first drilled segment and for the threads of the screws to bite solely from the far cortex, thus creating robust compression forces across the fracture. We use a countersink to ensure the screw's head sits flush against the bone surface and then use a depth gauge to measure the length of the drilled hole. We then insert the appropriately sized lag screw. With this fixation in place, we can remove the clamps holding the fracture and place a plate along the bone for definitive torsional and neutralizing stability. With the plate positioned, we repeat the steps of drilling, measuring, and placing screws until there is sufficient fixation throughout the length of the plate. Some of the hardware is cortical screws which help with compression of the plate to the bone. Other hardware that we insert is locking screws which help to support the bone with a rigid construct. All of this is done under C-arm fluoroscopy guidance so that we have real-time feedback of alignment and progress. Once all hardware is implanted, we perform a final washing of the surgical area to clear away any remaining debris and to minimize infection risks. Here we have a great look at the metal that is now stabilizing the arm to heal properly. Next, we move on to the final phase of surgery, which is wound closure. Using a strong dissolvable suture, we close the deep layer of subcutaneous tissue. A good tight closure at this level helps to prevent hematoma formation and approximate the most superficial layer of skin nicely. A big incision like this takes time to close, but just as important as the internal hardware is the appearance and quality of the incision closure for overall healing. Once the suture layer is finished, we place staples on the skin layer to complete the open reduction and internal fixation humerus fracture surgery. Given the severity of many humerus fractures, patients will often have weight-bearing restrictions placed on them to allow for adequate healing prior to stressing the arm. Patients will follow up with us in the clinic in 2 to 3 weeks for staple removal and updated x-rays to assess healing progress. While in the hospital and throughout their recovery, it is crucial for patients to work closely with physical therapy to regain strength, mobility, and independence. Thanks for joining us on this walkthrough. Make sure to subscribe to the channel for more point-of-view insights into the orthopedic trauma OR.